Thank you very much, Mr. Chairman, and let me thank you all for being here today. I believe I've been serving on this subcommittee longer than anyone on the podium, and quite frankly, I am frustrated that our veterans have been waiting more than a decade to try to get this situation accomplished. Year after year, first it was struggles between the VA and DOD. We appropriated millions and millions of dollars. We finally get to a point where we think that it's going to get done in 2018 after all those years. And we continue to have problem after problem after problem. What is it going to take? And what will the costs be safety-wise to veterans while the data is being transferred? What steps are you taking? I think the GAO has indicated that there was some issues with allergy and medication and immunization data which affected patient safety concerns. During this process, which now has been almost a decade and a half, I mean, veterans are having to suffer. And how are you maintaining the risk level to make sure that veterans are not impacted by this transfer process? And what lessons have you learned with the deployments that you've already done that are going to inform you to try to get this done? And ultimately, with all of the billions of dollars that we have already spent, and every year we're adding more to that, ultimately, what will be the cost savings? Will we ever recoup our investments? And how are you going to, do you have metrics? And I've heard a lot of questions this morning about the metrics. What are your ultimate metrics for rolling out this system? Can you just kind of address that? My frustrations are really welling up because I've listened year after year, meeting after meeting. I've heard people from VA, from people from DOD talk about where we are on this, and I've seen the appropriations bills roll out, billions of dollars. Please, can you address that for me?
Let me start. I've been with the program through the EHR, the DoD program, and also my office used to run the Health Information Exchange, and I'm sure you're one of the people that got calls from your constituents that said, I've had to take a wheelbarrow and collect all my records from the various VAs and wheel those over, from DOD and wheel them over to VA. And literally this has happened, 15 years ago. But since that time, as Dr. Evans, we actually have made a lot of progress, not satisfactorily, I will agree with you, but we have made progress where now within 3 minutes, I can get a veteran's record from anywhere in the country. Again, we're connecting to 90% of hospital systems. Anywhere in the country within 3 minutes, we do a query, we go out and get their episodes of care, hospitalizations, office visits. It's there. It's not integrated. It's like in a PDF, but that's the state of the Health Information Exchange. But let me go back to some of the issues that you talked about specifically, patient safety. So I made a career, one of my past lives was a researcher in patient safety, especially around IT systems. One of the problems we have is we try to make, that causes safety problems, is we try to make the system, another vendor system, work like Vista. And so we've come into these with our human processes that are tuned to work with Vista and trying to apply those same human processes to work with Oracle. That's been a problem. And some of the unknown Q issues that you brought up are related to not understanding how to really work optimally with the system. In addition to changing our workflows to work optimally with the Oracle system, we are doing now a proactive, we're getting the data from Oracle into our enterprise data warehouse and running algorithms on those data to proactively identify problems before they even, before the healthcare systems themselves know that there may be a problem. Again, safety is a Swiss cheese problem where you have to line up all the holes in the cheese for something to happen. And so we can detect electronically when the holes are lining up before there's patient harm. So we're combining many systems, supplementing the Oracle systems to get to patient safety. And I won't take any more time, but I'm happy to elaborate.
Anyone else want to comment on that?
I mean, I would just emphasize, I think I agree wholeheartedly with what Dr. Nebeker just said. First of all, I think we have made a lot of progress. And I think it's we have an application called the Joint Longitudinal Viewer. And when you open that application, which every VA clinician is opening today, or most of them are if they need information, they can see information from every DoD site, every VA site, and 90% of American hospitals. And so we've made a lot of progress with regard to the availability of the data.
How close are you to the finish line?
The finish line is, there's health data interoperability is one question. Do we have access to the data that we need to take care of veterans? And I think we're getting closer access to the data, but the ability to use that data and have it integrated into an integrated, single, standardized national health record, we need to get to the finish line with regard to this project.
Well, how close are you to that finish line? I mean, we've got VA clinics all over the country. We have CBOPs. All of them need on a daily basis to have access to that information.
They have that now.
They're still expressing to my constituents and my caseworkers problems accessing that. And they're also expressing that they're having concerns with getting accurate information. So I'm just frustrated. I mean, this has been almost a 20-year process for me. I had that different people that come and sit at this table, every 2-3 years and give us updates. But, we may be not where we started, but we are certainly not where we had hoped to be 10 years ago. Mr. Chairman, I yield back. My time has expired.